Hello and welcome to the APAP podcast. My name is Valerie Young. I'm the president of the Association of Pulmonary Advanced Practice Providers and your host today for the podcast. And today with us is Dr. Valerie Young, no relation. She is a widely recognized thought leader on imposter syndrome, which is what we're going to be talking about today. She has spoken for over 100 universities, including Harvard, Stanford, Oxford, and for such diverse organizations as Pfizer, Google, HelloFresh, the National Cancer Institute, NASA, and the NBA. Her award-winning book with Random House has been published in 7 different languages, and in 2002, she co-founded Imposter Syndrome Institute to meet the growing demands for organizations to empower individuals and teams and create imposter syndrome-free cultures. And Dr. Young, I am so thankful to have you here today on our podcast because I think there are a lot of professions in the medical realm that suffer from imposter syndrome. However, I think nurse practitioners and physician assistants, or what we call APPs, definitely suffer from it the most. I'm sure everybody thinks they have it the worst, but I feel like we definitely suffer from it the most. So could you first help us unpack or understand more about exactly what imposter syndrome is?
Sure, absolutely. Well, first of all, thank you for having me on here, and we will talk about your audience being the Beyonce of imposter syndrome sufferers, right, who experience it the most. The term imposter phenomena was coined in 1978 by Pauline Clance and Suzanne Imes, 2 clinical psychologists who observed it in women they were seeing in private therapy, as well as these kind of growth awareness groups that they were running on university campuses. And most of their observations were done with undergraduate students, some graduate students, some medical students, and some faculty, and a limited number of professionals. But essentially what they found is this pervasive dismissing of our abilities and achievements and belief that deep down we're really not as intelligent, capable, competent as everyone seems to think that we are, which leaves us with this fear that sooner or later the other shoe is going to drop, that sooner or later we're going to be found out. I just want to mention quickly, even though it very quickly morphed into imposter syndrome in the popular culture, and I mean within a couple of years after the term was first coined as imposter phenomenon, it's not, nor has it ever been considered a psychological disorder of any sort. The frame of reference for folks in psychology is the DSM, the Diagnostical Statistical Manual. I think for most of us outside of the field of psychology, the frame of reference is the dictionary. And the dictionary defines a syndrome in part as being thoughts, feelings, and behaviors that constitute a pattern, which perfectly describes imposter syndrome.
Excellent. Now, I know there are people out there who think, I don't have imposter syndrome, do I? Maybe I do. And what would be some behaviors or some actions that you would see in someone who may have more imposter syndrome or issues than maybe they think they do? How would it impact their career or their advancements or decision making?
Sure. Well, I would say if they don't think they experience it, then they probably don't experience it. But there are some behaviors that people who do, and let me also be clear, you can have it on a if you take this assessment that Pauline Clance created, there are kind of low levels of imposter feelings, moderate, and then very intense feelings. So for folks on the intense end of the scale, it really can be problematic in terms of our career and health and so on. But often it shows up in the form of different coping and protecting mechanisms. In other words, when you feel like an imposter, you have to find a way to do 2 things. 1, manage the anxiety of waiting to be found out and actually avoid being found out. So on a very unconscious level, we do things like, one person might kind of fly into the radar, like hold back. They don't go for more challenging opportunities. They wouldn't, volunteer to speak at a conference, for example, or take on a leadership position. Stay in jobs or roles they've long outgrown. They might not share an idea or ask a question, in a meeting. This idea that if I can kind of keep my head down, do my job, kind of play small, it's safer there. But if I put myself out there, I open myself out to more scrutiny and potentially failure and being quote unquote found out. For other people, it might be the complete opposite end of that, which is overworking, over preparing. And I don't mean good old-fashioned hard work, but the sense that you feel like you have to work harder, study harder, stay longer to kind of cover up for your supposed ineptness. For other people, that might, show up in terms of various forms of self-sabotage, sabotaging your career, showing up late to an important job interview, or being chronically late. It could be alcohol or substance abuse. And for other people, it could be chronically procrastinating on like high impact activities. And let me just show you briefly how procrastination might protect us. So years ago, young woman at a college wanted to get this very prestigious internship. To get it, she had to complete a lengthy application process. She had 6 months to do it. Let's say it's due June 15th. When do you think she starts it, Corey?
Probably June 1st.
June 14th, the day before. She gets it in on time, but she doesn't get the internship. So how procrastination protects us is we can say to ourselves, well, I'm disappointed, but I'm hardly surprised because I know it didn't represent my best effort. But the rub is, if she had been successful, she probably would have felt undeserving and gotten to the internship and been worried she was going to be found out. And sadly, for far too many people, especially in STEM and medicine, procrastination turns into never starting or finishing the degree, the certification, etc.
Yeah, I feel a little bit of all of those things, and it doesn't seem to get any better the longer you're in that profession. I don't imagine. I've been doing this for 19 years now, and I still have this sensation of I don't really belong here. I'm going to be found out. All of those things that you have definitely said.
Yeah. Well, I think it's especially true in medicine.
Mm-hmm. Yeah. With nurse practitioners and physician assistants, especially working in areas where there's not a board certification, I think that really makes us vulnerable to these feelings. I'm board certified in family practice. I worked a year in family practice, and since then I've only been working in pulmonary medicine, and there's not an opportunity for us currently in the year 2024 that we're recording this. There's not an opportunity currently for us to have our knowledge vetted, to be board certified in this area, to be a pulmonary APP.
Right.
I'm a family practice nurse practitioner masquerading in this pulmonary position. What are your thoughts on that, or advice for those of us that are in this position?
Yeah. Imposter feelings are more prevalent in certain occupations for different reasons. You see a lot of people in creative fields more likely to feel like imposters, but also people in science, technology, and medicine, especially in very information-dense, rapidly changing fields where we feel like we should be able to keep up and no human possibly could. What is more unique about the medical field is, like some other fields, but especially in medicine, there are these kind of hierarchies. Everyone knows surgeons, it's considered more prestigious than being a pediatrician or what have you, right? And even within disciplines, there's hierarchies of what is considered more or less prestigious. And then, systemically, you're not allowed to get this validation, which is highly valued in the field. You're going to have some feelings about that. My response to that is, it is what it is, right? I mean, I was doing a podcast for the British Medical Journal, and it's a slightly different story here, but it was two young women on. One had just graduated from medical school. The other was a resident, a couple years into residency. They were lamenting the lack of positive feedback in medicine. The best you can do in the UK on your final exam to graduate medical school is no concern. We have no concern about you, which is very British. The point they made to them was, that sucks. Just like your situation, that sucks. But here's the thing. What I said to them is, they didn't know that was the culture they were signing up for when they went into medicine, but that's the culture they're in. And when you know that, the benefit of knowing that is that when you have what I would consider a normal imposter moment, you can do more contextualizing and less personalizing. So you can choose to kind of take that on, other people's perceptions, or you can choose to, have the strong kind of core within yourself that you're a valued member of, of your practice, of the community that you operate in, and you have something of value. And the reality is that other stuff, it's the reality. So it's always, in my view, like what we do with these things. I have an EDD. For people who have a PhD, I am like the bottom of the barrel, right? There's definitely that kind of snobbery. And then within academia, people in STEM fields look down on people in behavioral sciences, and it just all, trickles down. I so don't care. I so don't care, right? You have to get to a point where like you don't have anything to prove to people. And that's, I think, the work that we need to do in terms of our own, developing that strong core of confidence and competence.
Knowing what you know, I think knowing where your weaknesses are, areas you need to work on, working on those areas, I imagine that definitely helps solidify that core.
Yeah, and thank you for saying that, because most people only focus on knowing what your strengths are. Google, I've done a lot of work with Google. They have a program called I'm Remarkable. And essentially they created this program because women, especially internationally, were having a hard time talking about their achievements in a performance review. Some of it's gender socialization, some of it is cultural, but they created this program to help women get more comfortable talking about their accomplishments. So at the heart of it, you make a list of your accomplishments. Everybody takes a few minutes, they write down a list, and then everybody goes around and says, I am remarkable because. The feedback I gave to my client at Google was, I think you should rename it. I'm remarkable and some days I suck. Because we're not always going to be remarkable every day. And yet in medicine, what makes medicine also unique is you are dealing with health and safety and life and death, which is not true in a creative field. And it's not true, generally in technology or, certain other aspects of STEM. But that, so for example, you are going to see more perfectionism in medicine because the ramifications for mistakes are more serious.
Oh, absolutely. And not only the health and safety and lives of our patients, but your livelihood. Could you lose your license? Your ability to practice medicine, all these years of education you've devoted, that's a huge fear, huge fear. Back to the hierarchy discussion that you were having, I think another thing that might make it more difficult on us, and I didn't think about it until you were saying this, pulmonary tends to be a combination of pulmonary and critical care together. And critical care, we are the 911 for the hospital. If a patient crashes anywhere in the hospital, they tend to end up in the ICU. And we're managing those cases that have failed other treatments, have had an acute moment. And we are who all the other specialists are looking to salvage this patient. And so at that point, we're at the pinnacle of that healthcare system of managing that patient. And these are truly potentially the last moments of a patient's life, and you have to make the right decisions. And even some of my very, very seasoned critical care APPs that I've worked with that work at big institutions that are cranking out massive amounts of research at changing the landscape of what and how we do things in critical care medicine, they even really struggle with, I'm very worried of what my physicians think of me. I mean, they are our employers as well, and they tend to have very high expectations of our performance as well without that fellowship or board certification that they had in that place. So it really puts us in this very difficult position of very high expectations of performance and very low levels of support educationally, emotionally, feedback-wise, all those things that you had mentioned. So I always felt like imposter syndrome was a big thing for us. And now that you're pointing all these things out, I think we're the poster child for sure.
Yeah, and then you layer, things like gender in or race or whenever you belong to any group for whom there are stereotypes about competence or intelligence, you're also going to be more susceptible to imposter feelings.
The bulk of nurse practitioners tend to be female. Of our own membership at APAP, we are about 75% female, which also makes our poor male counterparts, the minority, in this situation when they're working in these areas. And so Any advice that you have as far as good support mechanisms? I mean, us at APAP, we are trying to develop standards of education, standards of pay, standards of benefits, because there never has been an organization like this before. And we love, we love data sets, we love numbers, we're nerds for numbers, we like guidelines, and there just hasn't been anything like that for us, which I'm hoping will give us some level of stability in our profession. Is there anything else you think as an organization or within institutions that can be done?
Yeah, absolutely. First of all, the kind of support you're providing is really important because it's easy to get in your head. It's easy to think you're the only one who feels this way, and having a place to go and connect with other people who are going through similar experiences, I think is really important, because you could become very kind of isolated in generally speaking, and then, with imposter feelings as well, and kind of make this assumption that no one else feels this way, or they're saying they're imposters, but you really are an imposter, which was my experience when I was a doctoral student. I used to call myself like the Beyonce of imposter syndrome. I think the biggest thing that organizations can do, and associations like yours, is to help people unlearn imposter syndrome by recognizing that people who don't feel like imposters, and by that I mean people who are genuinely humble but have never had imposter feelings. I don't mean that kind of narcissistic, proverbial kind of smartest guy in the room whose belief in their knowledge and skills far exceeds their actual knowledge and skills. I mean confident people who's, again, humble, but they've never felt like an imposter. They're no more intelligent, capable, competent, qualified than the rest of us. It's just in the exact same situation where you or I might have these imposter feelings, they're thinking different thoughts, which is really good news, because it means we just have to learn to think like them. I call that person a humble realist. And it's not a pep talk. And I find a lot of folks do the pep talk thing around imposter syndrome. They remind people of how wonderful they are and all their accomplishments. And, you got it, and you can do this, and you deserve to be here, which if all it took was a pep talk, we wouldn't even be having this conversation around imposter syndrome. Right? It might be helpful in the moment, but it's not going to stick, and it's not going to move the needle in any lasting way. And the reason is humble realists think differently about three things. They have a realistic understanding of competence, to include knowing their strengths and where they need to work on things. And frankly, some things we might never be good at. I always say I'm really good at 3 or 4 things. I'm pretty good at 5 or 6 other things, and I suck at everything else. And I'm okay with that, right? I'm gonna lean into the things that I do well, maybe get some, training and work on some other things. But there's some things like, nope, that's not my gift. That's your gift, right? I'm never going to be good in that particular area. So they have a realistic understanding of competence. And if folks are interested, you can get a free, download a chapter from my book. The chapter is called The Competence Rulebook for Mere Mortals. And it goes to these 5 different ways that people who feel like imposters, I measure their competence. These competence distortions, like the perfectionist, the expert, the natural genius, the soloist, and the superhuman. And I mention that because that's the most, frankly, plagiarized part of my work, but also utilized. There's like 3 million searches for what are the 5 types of imposter syndrome. That's my work. They're not personalities. They're not personas. They are ways we distort what it means to be competent and apply those standards to ourselves. So that's one thing to help people shift, to have that realistic understanding of what it means to be competent. And also to have a healthy response to failure, mistakes, setbacks, constructive feedback, etc. Because for folks who feel like imposters, and I think women especially, constructive feedback, which we experience often as criticism, we let it mean more about who we are as a person. Someone says to you that report was inadequate, we hear, I'm inadequate. And that can be, people who are humble realists, they see constructive feedback as a gift. Like they're seeking out information to constantly get better. But I think for folks who feel like an imposter, we lean much further into our mistakes and failures and shortfalls than we do, into the things that we do well. So a healthy response to failure, mistakes, constructive feedback. And the third part of that, where humble realists think differently, is they understand that a certain amount of fear and self-doubt is part of the achievement journey. People with imposter feelings, we conflate competence and confidence. We think falsely, if I was really competent, I'd feel confident 24/7. And my response to that is like, good luck with that, right? We have moments of confidence. We have moments of fear. So don't take the fact that you might be anxious before some big moment or case or situation as being not ready or qualified. It's just probably a normal response to that kind of fear, excitement response that happens in those moments.
That is an excellent piece of information because, you know, I can't tell you how many codes I've run on a patient, and they're all different in their own little way, but it's still a code. It still has a very finite structure that you tend to follow. And every time you get a little anxious or worried, and that's a great thing to remind yourself of, that this anxiousness does not mean that I'm not prepared for what's about to happen. That's a good mantra.
Yeah, absolutely. You know, and your body doesn't know the difference between fear and excitement, right? Sweaty palms, nervous stomach, dry throat. So I'd rather go into it going, you know, I'm ready and excited, and maybe not always excited, not the best word, but not like had horrible fear.
Right. We do have a couple weirdos that are very excited about codes. That can definitely happen. So you had mentioned previously about this high level of imposter feelings that can be paralyzing. So if we have, if we are experiencing those feelings, where do we seek help? Is that something you see psychiatry for? Is that something that you see a life coach for? Is that, where would someone seek help to work on that?
Well, certainly, you know, for some people, if they can very clearly trace a line to family messages and expectations, you know, somebody had said to me in her family, she came from very, highly educated, successful parents. And the message was, you know, like, if you're not, you know, excellent, like if you don't get all A's, like don't come home, right? Kind of very strong message. Other kids might have gotten no praise at all for academic achievement or gotten really negative messages. So if you really think that that is the issue, then, you know, I think therapy is good. On the other hand, you know, we weren't all raised by the same family. We didn't all get the same messages. I'm not a big fan of, it's not one thing, it's your mother. You know, there's more going on than family dynamics. I know people who spent years in therapy trying to like find like that one thing, like that thing their father said to them that caused all this. And there may not be this thing. It may, again, be the stronger variable might be gender. It might be being in medicine. I mean, there's other things going on, or again, you know, gender, class, so many, race, etc. So many other things could be happening at the same time. Certainly, you know, some folks go to coaches, but in my experience, a lot of coaches they're doing more leaning into the pep talk approach. We created a program called the Imposter Syndrome Informed Coach because we want coaches, because they work with so many people who experience imposter feelings, to be well informed. There are people who have no idea how much research, academic research, is done on imposter syndrome. And the first book just came out literally a week ago called The Imposter Phenomena, edited by Dr. Kevin Coakley at University of Michigan, that looks at all the hundreds of studies on a variety of different aspects of imposter phenomena. So find a coach who is imposter syndrome informed, I would say. But I think that we can really do a lot on our own, you know, if we just kind of have some of the basic tools to normalize imposter syndrome, reframe, right? Become consciously aware of what is the conversation going on in your head when you're having a normal imposter moment. And then how can you kind of hit that pause button and reframe it the way somebody who, again, is humble but has never had imposter feeling, how could you reframe it to think different thoughts? You know, my mantra is always, the only way to stop feeling like an imposter is to stop thinking like an imposter.
Definitely easier said than done, but I can see how that would definitely work. And I hate a pep talk. I hate pep talks. So I can definitely see why that would not work, because that, I mean, personally, that would never work for me, to tell me, you know, everything's going to be fine. It's all going to work out. Like that never works for me. So I'm glad you mentioned that, because I always felt like, why do people do pep talks? It never works for me. I don't like that very much. So.
Right. Absolutely. And can I just pick up on something you just said, that it's easier said than done? And you're absolutely right. anything worth doing is always easier said than done. It's easier to talk about losing weight than to lose weight, or talk about getting in shape than it is to get in shape. So yeah, we do have to bring a decision to say, I'm going to work on this. I'm going to give it a 30-day, how can I rethink different thoughts, even though I don't believe the new thoughts, and try that on for 30 days, for example, and then act like somebody who actually believed the new thoughts. How would you act differently if you really believed that you were entitled to ask for help, or not understand something, or have an off day?
Mm-hmm. Yeah. There's been a lot of research I know about just positive affirmation, positive self-talk, those types of things, and how they've impacted people and their interaction with the world and their self-esteem and that type of thing. So yeah, I could definitely see how that would work as well. Well, you have a book out, and I'm sure that would be very helpful for everyone as well in understanding this a little bit further. And they can get this anywhere. It's available at all places.
Yeah, it should be. It's called, I hate the title, honestly. It's called The Secret Thoughts of Successful Women and Men, Why Capable People Suffer from Imposter Syndrome and How to Thrive in Spite of It. And the reason I hate the title, Corinne, is that I've had so many women, full professors, successful women executives say somebody walked into their office, saw the book on their desk and said, "Oh, what are your secret thoughts?" And they kind of went, "Oh, they're talking about me." Right? They didn't recognize themselves. And a lot of us, even though we are by all measures, quote unquote, successful, we think of that as like the CEO or somebody on this very, very, the head of the hospital or what have you, and not ourselves. I would have rather called it something like How to Feel as Bright and Capable as Everyone Thinks You Are.
Oh, that is a really good title. Again, a really good mantra too.
Yeah.
Well, we will definitely make sure that we leave links to your website and also to your book, because I think this is an excellent resource, a great non-medical read when we're tired of reading about, like you said, all the things that are constantly changing in medicine. This is a great non-medical read for us to make sure, again, we strengthen that core of who we are and help us with our career going forward, and not have such angst while we're at work and dealing with physicians, in our area as well. So, Valerie, anything else you would like to leave our listeners with before we sign off?
I would say this is true in your field and every field. Like, yeah, you might be dealing with somebody who has more degrees or board certified or whatever their status is. They don't know what you know. Like, own what you know and do what you train to do, which is to make a difference in people's health and their lives.
Excellent. Thank you so much for that. Thank you again for listening to the APOP podcast. Please like, subscribe, follow us on social media. It's the best way to help the organization along. And like I said, I'll be listing Valerie's website and links to her pages. And I hope that you guys spend the time reading it, because I think it's going to help all of us in this field. Thank you again, Valerie.
Thank you. Thanks for having me.